pharmacogenomics has been something I've been really interested in. I love genetics in general, and there's that type of consideration is important in almost every single body system, every single disease state when you're thinking of how is this patient going to react to this medication. And it often becomes like a trial and error kind of situation of like, okay, we've got, 10 different options for you for whatever you're treating. And we're going to try the first one, see if it works for you. And that becomes a really long process. It can delay that patient, resolving whatever issue they're there for. And we've come so far to have the technology to do it. And it's funny because I actually now am working with a pharmacogenomics company called ID Genetics. And I took a test as well. They specialize in really testing for pain medications and for depression, anxiety medications like SSRIs.
Yeah.
And it helps patients be able to have that clarity when they take that test, and their provider can kind of have a better idea of what they can prescribe or maybe change the way that they're prescribing it. It's a huge tool that I hope becomes a standard in a lot of places of care, especially in the mental health space, which when someone's coming in and struggling with something like depression, to be able to have a streamlined treatment protocol for them.
Well, so the interesting is that, in the last 2, 3, 5 years, these DNA tests, these at-home DNA tests have come out. Ancestry.com, 23andMe. And now they're even elevating it and going, hey, so we're able to study and learn more, and these are the things we've learned. And 23andMe recently started adding in, medication, how you metabolize certain medications.
Yeah.
And if pharmacies could get paired up, or just like when I sign into MD Box and I do the visit and they say, where can we send your information? What pharmacy? Same thing. If I could tell 23andMe what pharmacy I want to send this type of health data to, and we had a way to process it so that way that pharmacist knew I was a rapid metabolizer of that drug, they wouldn't give it to me. They'd call a doctor and say, hey, this isn't going to work.
Yeah.
That's a whole nother level that we just
one of your big barriers to that taking off is just the payment model.
Oh yeah,
most third parties won't pay for it today, and so your only people getting that are people who are paying for it themselves.
Well, they're paying for it and they've already paid for it because they want to know, hey, where's my origin? I'm mostly from Europe, or I'm mostly for here. Oh, cool. I get to learn about how my body metabolizes drugs. Why is this important? Yeah. And there's that piece of patient education that's still missing on the importance on the things that you put in your body, what it does to you.
Yeah, I agree. And it's interesting you talk about the payment model. I feel like I wish I could go to insurance companies and tell them, like, hey, if you do this pharmacogenomics testing, I'm sure the cost savings for a lot of people are there. Because of how many visits and how many trials and how many errors do these patients go through. Because I feel like it would be such a benefit in so many situations. But of course, I can't be the one to kind of wave the magic wand over the insurance company because, of course, they're not expensive, a lot of these tests anymore, but they still are relatively pricey. I mean, a couple $100s, I'm sure.
Well, and what happens, and here's what's wrong with our country, and it's free enterprise is right and it's wrong, but the problem is that there's always some guy out there trying to beat the system, right? So the payer pays for it, and all of a sudden you have the guy who sets up shop on the block and is calling Medicare patients and signing them up for these tests, and so they can do thousands and thousands and thousands of tests that people don't really, some of that depends on what drug you're on. It really ought to be keyed on, hey, I'm going to go on this type of drug, and hey, that's one of those that matters based on your genetics. Yeah. Let's schedule you a test, then we have it forever, kind of thing. So it's interesting. You can kind of see it on both sides sometimes, but it's definitely a thing, and we keep hearing lots about it over the last few years, and lots of companies have tried, and hey, we can't get a payment model. Are they trying to get too aggressive? Are they trying to figure out how they make money long term? Because it's just tests. You sell somebody a test, I can imagine we're on Shark Tank, and they're like, yeah, but hey, once people buy one, they've got it forever. Yeah. What's your long-term business model? Yeah. And they try to do things like, well, you're going to take the test, and I'm going to hold the data, and you're going to pay a monthly fee, and this kind of stuff. So it's interesting how it's a really cool marketplace, but it's interesting how it's going to take off. And imagine that's as technology advances and the cost drives down, it's going to get small enough in cost it doesn't matter.
Right.
You know, your pharmacist maybe to do it in a chip for $10 there in the pharmacy with point of care testing.
Yeah, that would be awesome. I hope that we get to that point. And I think that we absolutely could. I mean, you see how far genetics have come in the last 20 years. And maybe in 20 years, we'll be doing the same thing. So I'm looking forward to that because I think that it would be great information for providers and for pharmacists to have as well.